Hello dear students, welcome to Dr. Fleming medicine classes. In today's lecture, let's try to discuss about penicillins. Okay, so penicillins are one of the beta-lactam antibiotics, and in beta-lactam antibiotics we have cephalosporins, monobactams, carbapenemes and penicillins. So these are the examples of beta-lactam antibiotics. So beta-lactam antibiotics are nothing but the antibiotics which contains beta ring in their chemical structure are known as beta-lactam antibiotics. And let me draw a simple chemical structure of penicillin. So this is a chemical structure of penicillin. Here it's amine in H group and C double bond O and R. Here any alkyl group. Okay, so the ring, the square ring is called, this ring is called beta-lactam ring, beta-lactam ring, and this is called thiazolidine ring. Anyways, this ring will not have major significance, but the antibiotics which contains this ring are called beta-lactam antibiotics. And in penicillins, almost all chemical structures will have this ring, so they are called beta-lactam antibiotics. So listen carefully, penicillin is the one of the very important antibiotics, and it is the first antibiotic discovered by man, and it is used clinically. The first discovered antibiotic. Remember, it is an antibiotic, it is not antimicrobial agent. Before penicillin was discovered, we were using antimicrobial agents like sulphonamides and quinolones, some other we have urine antiseptics. So they were used previously, and this was the first antibiotic which is developed and used clinically. Okay, and after discovering penicillins, we tried to develop some other beta-lactam antibiotics like cephalosporins, monobactams, carbapenemes. Okay, so that is about penicillin. And remember, penicillin, in penicillin we have penicillin G, and we have other penicillins, semisynthetic penicillins, semisynthetic. Okay, so let us discuss. So penicillin G is the natural penicillin, and this penicillin is generally developed or obtained from the molds from the fungus called Penicillium. Okay, Penicillium notatum is one of the example from where this penicillin is usually developed. So penicillin G is the natural penicillin, and however this penicillin G will have many drawbacks. Because of those drawbacks, we tried to semi-synthesize some newer penicillins. Okay, and in this lecture let us try to discuss in detail about penicillin G. So penicillin G is the natural penicillin, and in penicillin G we have three different penicillin Gs. The first one is penicillin G, and this penicillin G is having duration of action up to 6 hours. Okay, so the common penicillin G duration of action is 6 hours, and this penicillin G is commonly, it is administered through IV and IM. It can be it is given through IV and IM. And we have procaine penicillin G. So this is another type of penicillin G, and its duration of action is up to 24 hours, and even this is also given through IV and IV and IM. And we have third penicillin G, and it is benzathine penicillin G. Okay, and this benzathine penicillin G, its duration of action is up to 3 weeks. Its duration of action is up to 3 weeks. So if the dose is given, it will act up to 3 weeks. Okay, and even this is given through IV and IM. Remember guys, penicillin G's duration of action is 6 hours, procaine penicillin is 24 hours, and benzathine penicillin duration of action is up to 3 weeks. Okay, and listen, penicillin G is commonly given at the dose of up to 24 million units per day. So it can be given up to 24 millions because of its lower duration and because of its rapid metabolism. It is given up to 24 millions, and procaine penicillin can be given up to 12 millions per day, 12 million units per day, and benzathine penicillin is given up to 4 to 6. Usually we use very low dose because its duration of action is very high, and because of the toxicity we usually give in low. It is around 2 to 4 millions per actually it is per month. Okay, per month 2 to 4 million units were given because of its high duration of action. So this is the natural penicillin, and even in penicillin G we have another penicillin. Usually it is a combination, so it is called fortified penicillin G, and in that penicillin we have procaine penicillin and penicillin G in the combination. Okay, so this is a natural penicillin, and listen guys, let us try to understand the pharmacokinetics of penicillins, especially penicillin G. So as we are talking, penicillin G is a natural penicillin, and it is not indicated through oral route because it is acid labile. Penicillin G is acid labile, and in the acid concentrations this penicillin G will destroy in the GI tract. That is the reason we commonly give penicillin G in IV or IM. Okay, and this penicillin G, it is not metabolized, usually it is not metabolized in liver, and it is distributed all over the body tissues, but it doesn't cross blood-brain barrier, but it is well concentrated in cerebrospinal fluid. Okay, so in meningitis conditions we can prescribe penicillin G, and even in that condition penicillin G is drug of choice. So it is excreted through urine, and remember penicillin G or all the penicillins are excreted through tubular secretion. They doesn't undergo glomerular filtration. They are excreted through tubular secretion, and through the tubules it will be excreted through urine. This is the very important thing. And remember, penicillins, when they are given with probenecid competes with penicillins, and it stops the tubular secretion and it stops the excretion of penicillin G. That is the reason probenecid may enhance or increase the toxicity of penicillins. So it increases the penicillin concentration. So that is about the pharmacokinetics of penicillins. And now the very important point, penicillins mode of action. Many students will be confusing here. Now let me tell you in detail the mode of action of penicillin. Remember guys, penicillins are more they are usually given for gram-positive bacteria, and they are very rarely used for gram-negative bacteria. So penicillin G, especially penicillin G, kills gram-positive bacteria when compared with gram-negative. So let us discuss. So let's discuss difference between gram-positive and gram-negative bacteria. Just listen guys. In gram-positive bacteria, we have the bacterial cell wall is made up of many peptidoglycan layers, and the layers will be around 100 layers. Gram-positive bacteria will have many peptidoglycan layers, and it will be around 100 group of layers, peptidoglycan layers. But in gram-negative bacteria, bacteria cell wall is not made up of peptidoglycan. So even in gram-negative bacteria, the cell wall will contain the peptidoglycan layers, but the layers will be just 2 to 3 layers. The cell wall will have only just 2 to 3 layers, and this peptidoglycan is encapsulated, or the cell wall is encapsulated with lipopolysaccharides. So the cell wall is made up of lipopolysaccharides and proteins. So this is a rough cell wall, and in the cell wall we have just 2 to 3 peptidoglycans. So this is the the main differentiation between gram-positive and gram-negative bacteria. And now let us try to understand why penicillins will act only on gram-positive bacteria, why not on gram-negative bacteria? Okay, so penicillins or the drugs, not only penicillins, all beta-lactam antibiotics will act on the destruction of cell membrane. So they are cell wall synthesis inhibitors. Okay, so let us understand the mode of action of penicillins. Actually, in gram-positive bacteria, the cell wall is made up of peptidoglycan layers. So this is one peptidoglycan layer, and actually the peptidoglycan layer will have a peptide chain and one glycan chain, and the same, this glycan chain again, it is attached to a peptide chain and glycan chain, peptide chain and glycan chain, and this will have in many layers. So it will be continuously present in the cell wall of the bacteria. Okay, so these two layers or these two fibrous molecules are called peptidoglycan molecules. So let us understand in detail how penicillin will act. So let me draw the chemical structure of peptide chain. So actually peptide chain will have 5 different amino acid molecules. Okay, and this amino acid molecule is attached to glycan chain, 5 different glycans, so pentaglycine and peptidoglycan, so 5, and these, the peptide chain is again, it is attached to some different chemical moieties called NAM and NAG, N-acetyl mimuric acid and N-acetyl glycosamine. So these are, anyways, will not have the great significance of these elements, and this is the structure of peptidoglycan. This peptidoglycan will cross link or will attach to the different peptidoglycan chain, and this will present all over the cell membrane. And listen carefully, here we have one peptide chain, and this peptide chain is again interlinked with a glycan chain. Okay, so we have to interlink this peptidoglycan with this peptidoglycan. Actually, this glycan molecule will bind with the 4th amino acid of the adjacent peptide chain, and this happens because the fifth amino acid is cleaved by one enzyme called dipeptidase. Dipeptidase is one enzyme which cleaves the 5th amino acid, and the 5th amino acid is D-alanine. D-alanine is the 5th amino acid, and even in the 4th position also we have D-alanine. Okay, D-alanine. So D-alanine and D-alanine are the 4th and 5th amino acids present on the peptide chain, and this dipeptide enzyme cleaves or removes the 5th amino acid from the peptide chain, and at the same point the glycan, which is the another molecule, will attach to this 4th D-alanine, and this makes the strong linkage between the peptidoglycan layers, and this will continue all over the cell, and this linkage helps the cell wall to get rigid. Okay, and we have penicillins. Penicillins are analogues of D-alanine. Penicillins are analogues of the amino acid called D-alanine, and they inhibit this enzyme, and by inhibition of this enzyme the cleavage of the D-alanine stops, and by that the interlink between this peptidoglycan and this peptidoglycan stops, and by that cell membrane generation or the rigidity of cell membrane decreases, and by that cell membrane will be impaired. So this is the mechanism of penicillins which stops the synthesis of cell wall of the bacteria, and so we have hundreds of layers, hundreds of peptidoglycan layers in the gram-positive bacteria, and we don't have peptidoglycans in the gram-negative bacteria. Even then the peptidoglycans are inhibited, the cell wall or the bacteria will survive because of the encapsulation, which is synthesized by lipopolysaccharides. Okay, the lipopolysaccharides will help the cell membrane or the cell wall to survive this bacteria. That is the reason gram-negative bacteria will not die because of penicillin therapy. Okay, so penicillin therapy is very commonly used for gram-positive infections. Okay, this is the mechanism. I think you understood about the mechanism, and now let us try to see some adverse drug reactions of penicillin G. Listen guys, remember carefully, penicillin G is actually, it is a natural penicillin, and it will have many ADRs. The first ADR is penicillins will have severe anaphylaxis reactions, or they have high hypersensitive reactions. They cause hypersensitivity. And remember, while prescribing penicillins or while administering the penicillins, we should check the penicillin whether the patient is hypersensitive to these penicillins or not. We have to inject the penicillin in the subcutaneous route, and we have to check whether any reaction is appearing or not. If the reaction is not seen, we can suspect that the patient is resistant to penicillins, and in that patients we can give. And if any reaction occurs at the site of injection, we should not indicate penicillins because they are hypersensitive to penicillins. So hypersensitivity is one of the major adverse drug reactions of penicillins, and sometimes these will be very lethal. Without knowing the hypersensitivity, if we inject the penicillins through IV or IM, patient will have severe anaphylaxis. So an anaphylaxis is a very dangerous condition which is associated with hypotension and shock. Patient will undergo shock and patient will die most of the time. Severe itching, and patient will become flare. So very dangerous situation, anaphylaxis. So anaphylaxis is treated with adrenaline. We have hydrocortisone and diphenhydramine. Diphenhydramine is antihistamine which stops the irritations or vasodilations and different itching situations in the skin. Hydrocortisone is a strong anti-inflammatory drug because inflammation is commonly seen in anaphylaxis, and adrenaline reduces or it improves the blood pressure of the patient, because in anaphylaxis patient will severely undergo into hypotension. So it is treated in that manner. So hypersensitivity is one of the major ADR with penicillins. And other ADRs like penicillins, however, they are chemicals and they cause fever most of the time. Nausea, vomiting are very common. Okay, so these are some adverse drug reactions of penicillins. And one major ADR is, listen carefully, we have a condition called Jerisch-Hexheimer reaction. Jerisch-Hexheimer reaction is very, very important ADR. So this ADR is commonly seen with the penicillin therapy. So usually penicillins will kill all the gram-positive bacteria, and by death of the gram-positive bacteria in the body, in the blood, the microorganisms, dead microorganisms will try to release some toxins or pyrogens, and that toxins will cause a severe reaction called Jerisch-Hexheimer reaction. And this reaction is its symptoms are very similar to syphilis. Remember syphilis, okay, because of these chemical reactions. This syphilis reaction is associated with fever, high grade fever. It is same like anaphylaxis, okay, but it is commonly associated with syphilis symptoms. So that is another major ADR. And now let us try to see some uses. Penicillin G is very, very importantly used for upper and lower respiratory tract infections. And in upper respiratory tract infections, in the sore throat, pharyngitis, otitis media, in the nasal infections, oral infections, and any dental procedure, when physician performs any dental procedures, even that time we can prescribe penicillins. So penicillins are very much used in upper and lower respiratory tract infections, and in lower respiratory tract infections they are commonly used for pneumonial infections, okay. And it is also given in syphilis, drug of choice, in syphilis, diphtheria and clostridial infections, okay, penicillins. And nosocomial infections, penicillins are commonly given. And yeah, these are some of the uses of penicillin G. And we have some other semisynthetic penicillins other than penicillin G. and they will have broad spectrum of activity, and their uses is different when compared with penicillin G. And listen guys, penicillin G is having different drawbacks, 5 different drawbacks. Just listen carefully. Its duration of action is very low. Penicillin G duration of action is very low. It's about 6 hours. However, we don't prescribe benzathine penicillin, but penicillin G duration of action is very low. That is one drawback. And it is acid labile, so it is not given through oral route. Most of the time we need to give penicillins through IV and IM route. So, and it is very narrow spectrum. It shows narrow spectrum of activity because it is very commonly used in gram-positive bacteria only. So that is another drawback. And yes, very important point. Penicillins are destroyed by some beta-lactamase enzymes. Okay, so beta-lactamase enzymes are the enzymes which are present on the bacteria, in the bacterial cell membrane or in the bacterial cell plasma, that will degrade the beta-lactam ring of the penicillins. And if the beta-lactam ring is degraded, it will not have its efficacy. So this is another drawback for penicillins. And the next one is, it has anaphylaxis. So anaphylaxis is another drawback. So these are some of the drawbacks of penicillin G. And now let us try to discuss some semisynthetic penicillins. Semisynthetic penicillins. So now let us try to see some semisynthetic penicillins. Semisynthetic penicillins are necessary because penicillin G are having many drawbacks, and to overcome that drawbacks we try to semisynthetic penicillins. Okay, in semisynthetic penicillins we have 3 different classifications. The first one is the penicillins which have acid resistant. So these penicillins are given through oral route, especially they are given through oral route. And in acid resistant penicillins we have penicillin V. Penicillin V. It is also called phenoxypenicillin. Okay. And the next classification we have penicillinase resistance penicillins. These penicillins are the drugs which are resistant to beta-lactamase enzymes which are present in the bacteria. They can survive even in the presence of beta-lactamase enzymes. So in this we have moxicillin, oxacillin, cloxacillin and dicloxacillin. Okay, so we have different examples in these penicillinase resistance antibiotics. Among these we have oxacillin is the majorly used drug, dicloxacillin and C-cloxacillin. Okay, so this, just remember it as MOCD as mnemonic so that you can memorize penicillinase resistance penicillins. And the third one is extended spectrum antibiotics. These are very, very important. In the hospital we commonly use these penicillins, and in these penicillins we have ampicillin, amoxicillin. Amoxicillin is very, very important drug. And we have carbacillin and ticarcillin and piperacillin. So piperacillin is very, very important. Here let me tell you, piperacillin and amoxicillin are very commonly used drugs, and these are having good bioavailability, and pharmacokinetics are very good when compared with others. Okay, and they have extended spectrum of activity. They are active they are active on gram positive and gram negative bacteria. Okay, so these are the 3 different classifications of penicillins which are commonly used in the hospitals, and these are semisynthetic penicillins. And let me tell you, these acid resistant penicillins and extended spectrum penicillins will degrade in the presence of beta lactamase enzymes which are present in the bacteria. So these drugs should be given along with the drugs which are beta lactamase inhibitors. So in beta lactamase inhibitors we have 3 different drugs. The first one is we have sulbactam, tazobactam, and we have clavulanic acid. Okay, so these are the 3 antimicrobial. These are not penicillins actually, but these are the drugs which inhibits the beta lactamase enzymes which are present in the bacteria which tries to degrade the penicillins. So these penicillins are given along with these beta lactamase inhibitors. So these will increase the bioavailability, not bioavailability, they increase the efficacy of penicillins. Now let me tell you the most common combinations which are used in the hospitals. The common combinations, the common drugs, the brands which are used in the hospitals as penicillins. So remember, there is a drug called Augmentin. Augmentin is formulated through oral form, IV form, IM form, okay? Because Augmentin contains amoxicillin and clavulanic acid. Amoxicillin and clavulanic acid. Amoxicillin comes in the classification of extended release and clavulanic acid is a beta lactamase inhibitor, okay? So we have Augmentin, we have amoxiclav as IV form, okay? And oral tablets, actually capsules, oral capsules are also available in 625 mg, 600 mg amoxicillin and 125 mg as clavulanic acid. So total 625 mg are available as oral capsules, okay? And we also have 1.25 grams of IV formulation amoxiclav, okay? So we have oral suspensions also. So this is very commonly used drug, and for pediatrics, for lower respiratory tract and upper respiratory tract infections, we commonly give Augmentin as best antibiotic. And there is another brand called Timentin. Timentin contains ticarcillin and clavulanic acid, okay? Timentin is also very commonly used drug in the hospitals. And the next one is we have Salbacin. In Salbacin, the combination is ampicillin plus Salbactam, okay? Ampicillin and Salbactam is the combination in Salbacin. And there is another drug called Tazobac. We also have Piptaz, which contains piperacillin and Tazobactam. Piperacillin is a broad spectrum penicillin, and Tazobactam is a beta lactamase inhibitor, okay? Here we have 4.5 grams, sometimes 4 grams of piperacillin and 500 mg Tazobactam, okay? In high doses also we give in most of the common infections, especially in pneumonia related infections. So these are given. And remember guys, penicillins are the common drugs for respiratory tract infections, for urinary tract infections. They are used in typhoid. Previously they were used in typhoid, but typhoid bacteria developed resistance in penicillin, so we use cephalosporin as drug of choice, and for typhoid we have ceftriaxone as drug of choice, okay? And it is also used in other infections related to respiratory system and urinary tract and other soft tissues and oral infections, eye infections also. So these are very commonly used. So these are the different formulations of penicillins. I think I tried maximum to cover almost all points about penicillins. If I miss any point from in this video, please don't forget to comment, and I will give you the notes in the description if you need the notes, okay? And you can comment, and don't forget to like our channel and subscribe it if you learned something from our video. Thank you for watching.